Good morning, my YouTube viewers. It is Palestine here. I'm sitting outside of the hospital, and the reason why is because you're not allowed to take any pictures in the hospital. And so I didn't want to get in any trouble for taking pictures inside the hospital, even if it was just a picture of myself. So I decided the best thing to do is sit outside the hospital. So I'm sitting outside the north block of the hospital, and I've just been in the Berkshire Cancer Center, and I had to be there at 8:30, and it's past 9:30 now. So I had to be there 8:30 for 9 o'clock. And then basically what they did was they called me into a room and they asked me a bunch of questions. And then after they asked me the questions, I had to go change into a hospital gown. And after I changed into the hospital gown, I went into the CT scanner room. And one of the things that they did is they made me practice my breathing, because when you're getting the CT scan and you're getting the radiotherapy, what happens is they want you to hold your breath. And the reason why they want you to hold your breath is that because they want your heart to be away from the radiation. And the reason why is because the radiation can give you heart problems. So the radiation itself is very dangerous. So I had to practice my breathing. I had to breathe in through my nose for 3 seconds, as much air as I could get in my lungs, which isn't much because I have asthma and COPD. And then what I had to do was I had to hold it for 20 seconds. And then after 20 seconds, I was allowed to breathe normally. But because I have asthma and COPD, it was actually a little bit difficult for me to do that. And I didn't do it just once. I had to practice it. So I did it about 3 times. And then they gave me the CT scan. And then when they gave me the CT scan, they put these little ball bearing markers around the area that they're going to radiate. And I think that they said, when I spoke to the oncologist, I think that they said that radiation is kind of like sterilization. I think that's what they said, that like when they radiate you, that they're sterilizing you. And I think that's what they said. And then while all this was going on, I needed to go to the bathroom, because I went to the bathroom at 8 o'clock when I left my apartment, and then I walked to the hospital. And then so it was like 9:30 before I was finished, and I needed to go to the bathroom. And as soon as I got out, as soon as I put my clothes on, I went and told my boyfriend. I said, I need to go to the bathroom. And another thing that happened is when I was in the radiotherapy department, there was a note saying that their CT scanner was going to be gone out and people were going to have to go to Bracknell for treatment. Well, I certainly was not going to go to Bracknell for treatment. I was just going to tell them that I couldn't get to Bracknell and I couldn't do it. But fortunately, I'm going to be able to stay in the town that I live in for treatment. So that's about it for my radiotherapy experience, except for yesterday. I saw this friend who I give things from handouts to, and he was telling me that I was a shroud waiver because I said that the drugs that I have to take have a lot of side effects. And he doesn't speak to me very nicely at all, and it's not very nice, but I still keep being his friend, because I go to handouts and I get him things at handouts. But you know, he could be a little bit more empathetic about me having cancer. And then just saying that these drugs are safe. No, the drugs are not safe. If they have to be prescribed by a doctor, they're not safe. And the drugs, the drug that I spoke about the other day, it's called AI. it's an estrogen blocker. It does cause bone thinning, brittle bones, and it is a dangerous drug. If it wasn't a dangerous drug, you wouldn't be getting it from the hospital. You'd have to get, you could go to a shop and buy it. So that's one thing that sort of irritates me, that my friend isn't taking my illness seriously. And the treatment that I get for this illness has a lot of side effects as well, has a lot of complications as well. But we'll just keep going. And so I made this video in front of the hospital because I've got it was like 9:30 when I finished, and I thought, well, I can't get to work early, because if I get to work early, then they'll ask me why I'm at work early. So I thought, well, I'll sit out here and make a video rather than making the video at home. So I guess that concludes my video. I've told you about my radiotherapy appointment. My next appointment is on 17 September. So I'll make another video on 17 September on my next appointment. Thank you for watching my video. If you like my video, please like and subscribe. And I'll be making another video for you very soon.